Good morning, everybody. Good afternoon, whatever part of the country you're in. Thank you guys so much for joining our August roundtable. Really excited about this one. This is a conversation that I'm having with prospective new clients, individuals who we're networking with and current clients, really central to patient experience. How do you use patient experience to drive growth? I want to introduce our panelists for today before we dive into questions. You guys are going to be hearing from Amber Nish, who is the CMO at Community Dental Partners. We've got Ashley Benny Kemper. Ashley, did I get that right? Benny Kemper. She's the marketing director. And I think, Ashley, you also do some work on the provider side as well, provider liaison side at Vital Skin Dermatology. And John Goodman, who's the managing partner at Best Mind Behavioral Health. I'm going to give you all a bit of a deeper dive introduction into our panelists today. But before I do that, I want to invite you to please send questions and comments through the chat as we're having our conversation. If you want clarity on something, if you'd like to understand a different perspective or a question that we may not cover, just drop it in the chat and I'll be addressing those throughout the webinar and also at the end in our Q&A section. Also, just so everybody knows, we will be sending out a link to the webinar probably within 24 hours. So if you don't get a chance to hang on till the end, or you had a team member who didn't get to join us, don't worry, we'll make sure that you have a recorded version. Looking at our agenda for today, we've kind of bucketed our questions into three groups. So first of all, understanding from our panelists, what are some common friction points? What are some issues that their organizations are facing when it comes to the digital patient journey, primarily digital, but also any kind of offline challenges? How are those impacting the ability to acquire new patients? Then we want to get some best practices from our panelists, some real tactical takeaways for y'all, so that if you are looking at implementing some new practices at your organization, you can hear how our panelists have been so successful within their organizations. And then we'll talk a little bit about building reputation, building loyalty, building up your word of mouth and referral. And I always like to end it with kind of a forward-thinking question for our panelists. So that's what we have in store for y'all today. Quick intros, and then we're going to dive on in. So really excited to introduce Amber. Amber and I actually just personally met a couple weeks ago for the first time. I was really impressed in speaking with Amber that she kind of drew from her personal experience as a mother of 5 kids. It doesn't say here, but amazing that Amber has raised 5 kids and held a chief marketing officer position. And I know, Amber, you were drawn to Community Dental Partners because of what the brand represented, what they made available, and the focus on patient experience for family dental. So really excited to hear from you and your experience. If y'all don't know Community Dental Partners, I think they've got over 90 locations now and growing rapidly as one of the top 10 DSOs in the country. So Amber's got some really amazing experience that you guys are going to hear from. Next up, I want to introduce Ashley Benny Kemper. Ashley's been a client with Cardinal for a couple years now. We actually partnered with Vital Skin Dermatology when they were just getting started. And Ashley has some really amazing experience, both in her role as the marketing director at Vital Skin, and prior to that had significant experience in one of the largest DSOs in the country. So Ashley, really excited to hear your perspective, having worked at multiple organizations where patient experience has been paramount. And then I want to introduce John Goodman. John and I actually met, was it earlier this year, John, when you guys were just starting the Best Mind brand? We had the benefit of really helping to get the brand off the ground, starting with logo and naming. And now you guys are looking at opening a new facility, which I know you're currently doing as we speak. So we really appreciate you being here. When John came to me, looking to partner with Cardinal, he said, I really want to provide a better patient experience than what I'm seeing out there in behavioral health today, which is real appointment availability, access to providers, not 4 weeks from now, but when the patient needs it. And I thought that was really cool. That was one of the reasons why we wanted to partner with you guys. So that's a little bit about our panelists. I'm going to take this off the screen so that we can really just focus on everyone's face and hearing from our panelists today. So let's go ahead and dive into our discussion questions. And this one is broad, but I'm going to pose this question to Amber first. Focusing on marketing's role in patient experience, because obviously there's an operational component to providing great care that we as marketers don't, have a day-to-day hand in. But when it comes to how marketing does impact patient experience, Amber, what do you think are some of the drivers of areas that marketing is having an impact on patient experience?
Yeah, so for me, I think one of the first things that we do with each of our clinical leaders and partners is we talk about a line defining the promise that they want to make in a patient experience. You really need to go and understand who is the avatar that you want to serve, who are the patients that you're trying, or the customers, whichever the situation may be, that you want to bring into your group, and what promise do you want to make to them from a patient experience. And so we really first sit down with them and we help get their brand clear and align and define that and help get the rules established for that. And so there's kind of this brand guide or this rule book that for us extends beyond just what colors do you put in the practice, although that's part of it, but also what hours of operation do you want to be available? And we do a lot of those things based on the avatar that they want to serve. And we kind of act as the customer's representative in marketing, and what are they looking for and what problems are they coming to us to help solve, and collaborate with the clinical leaders first and foremost to establish those functioning rules.
Work off of that really quickly. You're in a unique situation compared to Ashley and John in that you're managing multiple brands. So you have, a services organization and then a bunch of local brands. How, do you feel as if at the DSO level, there is a universal promise to the patient on the experience, or do you feel like every brand really has some freedom in how they want to be presented in their local markets?
Yep, I actually think it's both. So at CDP, there is a universal core value promise of humility, gratitude, different ways that we show up, and every team member and every patient gets that opportunity to have us show up that way. So that's a brand promise that we make. Another brand promise that we make is that we serve the underserved. That's really important to CDP. So there's some common core values that matter to every partner. And then at the patient facing, they do have the opportunity, again, to define who do we want to treat. We have some that treat Medicaid kids in a rural town or in an urban market. We have pediatric brands, orthodontic brands. And so really once they define that and we help them set the rule book for that, then we have the ability to support as many brands as we can and has come to understand and want to serve the underserved that align with CDP mission. Then we can have unique patient-facing brands with that rule book in place that guides those decisions.
Awesome. And Ashley, your perspective on this, you guys are primarily growing through de novos, right? And I know you've got a combination, at least, initially it was de novos. How do you manage that across a de novo?
A little bit differently. The community is a little bit different. The practices are a little bit different. So we're able to tailor some custom solutions to meet them, but there's still definitely the core foundation that we build our engagement strategies around.
Mm-hmm. Absolutely. And, when it comes to setting that expectation, and then how that expectation, when you do it right, how your growth can accelerate. I mean, John, you're sitting there today. I know you're working on opening, I think you said the 4th location. Like, how has the positive patient experience in the short time that Best Mind has been open and available to patients helped you guys to grow?
Yeah, I think with regards to the providers, right, and making sure that they understand, some of the things that we struggled with in our first couple of months is creating those core values and making sure that everybody understands how that affects what they do on a day-to-day basis, right? And so one of the challenges that we faced is ensuring that those values are upheld by kind of everybody within the organization. And as you grow and as you're hiring a lot of folks, sometimes that's a little bit of a challenge to balance that out, and then ensuring that is executed when you're growing as fast as we are. But it took us some time and some challenges along the way. But across the board, across all staff, all support staff, and all provider base, those core values are, I think some of the other panelists mentioned that those have to be clearly defined by everybody, and then everybody works off of that. Hopefully in a short period of time.
Mm-hmm.
And John, because you mentioned, challenges, and I appreciate you being an open book here. If you had issues with patient experience and maybe you've come across one or two, like how do you identify those? How do you at the central marketing function know when those things are happening?
Yeah, I mean, one of our core values is making sure that we have options and alternatives to just basic medical management. But we identified it pretty quickly because it was a KPI for us going into that, was that the providers would be involved in the alternative types of treatments that we're going to offer. And so we were able to identify that very quickly because we had set that up as a KPI initially when we started the company. So once you're able to identify it, it's the re-education, it's the collaborative approach, making sure the medical director is the educational part, because we're not clinicians, but we want to make sure that we're offering all our services as a behavioral health provider. And it worked really well. But there is a time lag, and that education needs to happen. So,
yeah.
Mm-hmm.
Amber, you guys are in a different, stage in your growth than John's organization. With 90 locations, do you guys have any tools or tactics that help you to identify breakdown in patient experience at any point in the journey?
Yeah, we do. We use as much automation and centralization as we can for those types of things. And so Google reviews, Facebook reviews are pretty important tools to us. And so we have those gathered centrally, and we've created a net promoter score that we watch for every practice region. So we can see it by leader, we can see it by individual practice, by brand. And so we use reviews consistently. We also do, like John mentioned, we track patient referrals, and we watch if referrals are going down or coming. We also refer to other services and specialties because it's important to us that we offer total patient care. So when we see the things going down, whether it's in-house to one of our orthos, or we have practices that we don't serve, maybe with a specialty just yet, but we still want to see those going out to other providers in the area because total patient care is so important to us. And we watch when those things start to go down. Those are pretty strong indicators that pretty proactive and quickly jump in to solve any patient experience problems we come against.
And Amber, for any of our listeners, either live or down the road, who don't know what tools to even, look at, do you have any recommendations? What's social listening tools or review tools you guys may be using at CDP?
For sure. So the first thing we do is we use a texting platform. We use NextHealth at our group, but a texting platform that will automatically send out a review request after every appointment is completed. And so to help drive those reviews up. So that's the first technology that we use. And then the second technology that we use is a combination of Hootsuite and then I can't remember the other vendor that they use to kind of support that, where we could gather and respond to the reviews at a centralized team. And then she has worked with our IT and our software development team to help build the NPS score reporting. And so it's just, again, it was a quick turn in from Google Sheets on up. So it's something super proprietary. She just sits and sort of enters that data and documents for us. And so we pull from review trackers. That's what it was. From those two platforms to help us gauge. So those are three tools that we use for that effort.
Awesome. Ashley, on your end, do you use any of those tools? Any other tools that you would recommend?
Yeah, we definitely still have the same KPIs, especially around NPS. We actually just launched with Qualtrics a few months ago, about 3 months ago, to do patient engagement surveys. And it's a dual approach. We're currently in the transactional phase. So anybody post-appointment gets a survey about their experience. We'll eventually move to relationship surveys, which will give us kind of that bigger picture view of that patient experience. But the second part of that is then soliciting for online reviews. So we partner with Ratings MD, which is kind of I don't know if it's necessarily a subsidiary, but a partner of Qualtrics. So after the patient completes their patient experience survey, they are given the option to leave a review on our social profiles, our Google business profiles, or any other healthcare networks. And it really kind of creates an integration into the website. So now we have star rankings on the website as well that shows from a provider and a location what kind of reviews they're getting. And again, pretty much
that just launched, right?
Yeah. Just launched. I think it's this morning.
Yeah.
So, yeah.
Wow. Big day. Awesome. And I get this question a lot, and I want to ask John and Amber this, because you guys, again, are going to maybe have two different perspectives based on the size of organization. And I'll start with John. Do you all believe, and I don't think there's a right or wrong answer, should review responses be handled centrally by a marketing function, or do you guys feel that that should be handled maybe at the practice or region level? How close does the person responding need to be to the actual point of care?
Well, we're so small. I think centrally is fine for us. I think as we get bigger, I think it's more on the regional. My take would be that more on the regional level, because if there's a consistent theme or a consistent message that's coming across in the reviews, obviously that needs to be addressed, I think, regionally. But we're so young and early, we can manage that all through the process. I found it interesting. There's a lot of different, some of the techniques that you all are using with regards to initiating patient reviews. It seems like there is a whole host of different platforms, and I was very curious to hear more, obviously offline, about what you guys are utilizing, because I know Cardinal has set us up with, I forget the name of
I think we're using Bird Eye with you guys, John.
Yeah. Bird Eye for Google reviews. Yeah. But it's interesting how many. I didn't realize that there was this many different platforms to initiate reviews. So
yeah, it's a crowded marketplace, and I think people you can either get overwhelmed and then not make any.
Open Dental is our practice management software, and they integrated direct online scheduling, which was another patient experience tool that we wanted to have. We wanted to create as much access quickly to, again, when you think about a digital patient experience, right? And the first thing they have to do to get a hold of us is call us. Then you've already created a roadblock. Nobody wants to talk on the phone. And so Next Health provided us with both direct online scheduling and all the tech capability that we needed. And so that's the reason we chose that vendor. And so I think you're right, John, there's lots of vendors out there, and there's lots of different reasons for your individual company or group to use a certain provider. I agree. I think Bird Eye is a great option as well. I think there's lots of vendors out there. And so sometimes you can get lost in the trying to choose which one to look at, especially if you don't know going in exactly what you need it to do. Then a good salesperson will get you excited about the shiny things that they can offer, and you forget why you even started with them. And so I'm a big proponent of, my team knows they have to create a matrix first and say, you have to know in priority what 5 problems or 2 or 3 or whatever it is have to be solved by each vendor, and then how they solve it. So that's another way that, as you mentioned, like looking through the sea of vendors and opportunities, that's one way that we kind of help filter it out. Otherwise, we just get distracted by, it can do this and this and then we're like, that's not even what we came here for.
While we're on this topic, and then I want to pivot to online scheduling, because I think that's a great transition. One question that's just relevant. Lynn in the chat asked if anyone uses reputation.com now or in your past lives. Has anybody ever worked with that vendor? No. Okay. Just curious. Sorry, Lynn, no point of view on that one, but we're happy to pull some information for you offline about that. Okay, Amber, you brought up online scheduling, and
patient drop off. If the patient experience was not good with the online scheduling and it wasn't simple, and we had seen a lot of different customized online scheduling programs that we really liked, but obviously an EMR proposed online scheduling program, our patient management was okay, but we wanted to make sure that that patient experience was going to be good, and we were not going to drop off patients in through that scheduling process. We spent a lot of time discussing this and looking at the different options. We are still in an evolution phase with this. I will say that it has changed the way we're thinking about scheduling patients and that experience, but we're not even close to being done. We will we will have a customized online scheduling tool, because I think and I'm curious to what some of the other folks here on the panel say, but we feel like we're still, that patient experience is not perfected, and we still are missing some of these folks that have some challenges with their scheduling platform. So,
and John, as a stopgap for having kind of that perfect solution, are most of your patients picking up the phone and calling still? Yeah. Ashley, any perspective on that? On the Vital Skin website, I mean, there's a number of ways to get in touch. What are you guys seeing is the breakdown of how patients are using the site?
And it varies really by location and kind of the maturity where they're at within their affiliation with our organization. But we've done everything from just general form submission, which you really have to have a tight relationship with your operational or your front desk team, because response is key on those. If it goes anything beyond an hour, we found out that patient doesn't respond, doesn't call back, and never ends up scheduling. And then we kind of went into our second iteration of using our for things, and ultimately trying to find a tool or technology that could do best in class at least 2 of those. Didn't have to get all 5 of those, but if we could have something to get the kind of top of the funnel, then we could fill in on the end. And that's where we came in with our third iteration. We found a product that allowed for a much easier patient self-scheduling experience. It literally can be done in 30 to 45 seconds. Mm-hmm. But the added benefit of it is they also had a chat feature. So if at any point during the patient's scheduling process, the patient was frustrated, they left, the PSR, the front desk person, was immediately available to chat with the patient real time and get them scheduled. Which we felt helped our conversion, but also aided us in other call to actions on the website. So within that marketing funnel, right, a lot of time patients come to the website and they're not ready to schedule. They may have questions on services, cost, et cetera, insurance. This chat feature now allows us on our website to pop up and be able to communicate live time with an agent as well. So
two quick follow-ups to you, Ashley. Number one, in terms of manning the live chat, I mean, is that a central function for y'all, or do you do that at the practice level?
So it's hybrid. Again, we're growing, we're maturing as an organization. So some of our regions are actually implementing call centers, and that frontline patient communication now will be handled at the call center, which is awesome because it's their only focus. They don't have patients coming in, interrupting them. They're not getting distracted. They're able to give them that real-time conversation. We do have other practices that it is manned by the front desk, and our software, we use Clara for scheduling and chat. We can see the chat times and how long it takes to respond and how many questions and what they're coming in about. And there's definitely a switch between, what's happening in a centralized call center versus what's happening at the front desk.
Awesome. My second question was going to be, can you make a recommendation, which you just did? Otherwise, I was going to say maybe the 4 of us should talk offline about just starting our own online scheduling. Because
I know. There are so many out there. Just like review management. I bet we looked at 20 of them. But the other thing I didn't mention was integration.
Extremely helpful. And I mean, Amber, I'm not sure how you guys are doing this. Do you all have centralized tech stack for scheduling? Do you allow the practices to kind of pick and choose? How do you manage that?
So for the partners that have been part of CDP sort of from the get-go, we are fully centralized with all patient communication and scheduling, except for treatment cases. So we do have the practice schedule and communicate directly with treatment cases, because we know the unique needs of each patient and each doctor are, so but for first visits and, general hygiene recare, we find that a centralized team works really well, and they can handle all communication. So phone calls, chat, texting, and also centralized review management. One of the questions that was posed in the chat was, how do you maintain the patient experience with staffing shortages? And centralizing is a way to do that, because anybody, people are way more willing to work from home right now. So our call center teams are all at home, and they work in both our call platform and our texting platform, which right now we're separate platforms, but we're doing some evaluations to see if there's a way to merge that. But they can text and respond waiting for inbound phone calls. And so that's worked really well for us. We do have a few partners that have recently on with CDP that still maintain the scheduling functions and communications at the practice level. But just like Ashley mentioned, the performance is not quite as high. But I always tell teams, I'm like, you've got people who are trying to talk to the person at the desk answer the practice manager, get I mean, they're just dealing with much bigger things than that phone ringing. And so, you know, you look at an abandon rate of sometimes 20 to 30% at the practice level for calls and texts. And so I'm a big fan of centralizing for that reason. And it gives us the opportunity to, I mean, we've got a 3% abandon rate at this point with the centralized team. So it's a significant improvement and also a way to tackle that staffing shortage that folks are dealing with at the practice.
Having enough providers to be able to expand your footprint. How does the provider shortage impact patient experience? And I'll put this out to John first, because John, I know you had to go through this even with just staffing up the first location, and now you're on to number 4. What have you seen?
Yeah, you know, one of the things is we're always recruiting no matter what. Even if we don't need the folks right to start now, I would highly recommend that if you're in any sort of growth mode, that is just part of your core functions of what you do as a leader in the organization, is that you are going to be constantly recruiting. And that is just the nature of where things are now, especially generalized, you know, physician assistant types that can sub in for, you know, a different specialty. So we are just actively recruiting, and it has been a challenge. We have not had any issues with regards to accessibility, and we've only been open for 6 months, but we are almost reaching that point. But we've been recruiting for the last 3 months continuously, and so that would be my recommendation. And I know that not from a tactical standpoint with regards to how do you minimize the challenges of that patient experience, but I don't really know how you can minimize that if you don't have the provider schedule, if the schedules are full, because if they're full, they're full. There's not much you can do about that, right? So, but that would be my only recommendation. So,
and I think Amber, you mentioned it early on. All 3 of you have mentioned, like, just setting the expectation, whether the expectation is that the appointments aren't available, you know, for 3 weeks. I mean, Amber, do you guys run into that? And is it just about making sure the patient knows that? Is it, you know, how do you mitigate that?
I mean, you know, the difficulty is if you tell a patient you can't see them for 3 weeks, you're not going to see them ever. Right. So by and large, if they're calling and they're seeking you out, they have more patients than they know what to do with. And the provider recruiting and management has been a challenge. And so I know that the recruiting team has done a lot to be more flexible. We live in a world people want to work 3 and 4 days a week. And so creating hybrid scheduling and creating flexibility and an opportunity where we multiple practices within a vicinity where we can share doctors, we can share providers has been critical. But then also is that we have to treat our, you know, a couple of years ago, patient flow was a big issue, you know, several years ago. And now it's flipped on its head where patients are wanting more healthcare. I think COVID created some of that where patients are wanting more treatment, wanting more healthcare. And now providers and people are wanting to work less. So we now have to treat our providers like the customers. We have to meet their needs. We have to understand that they want to work less hours, or we're going to have to pay them a little bit more to go into a remote rural area. Or we talked about anything from plane tickets to car bonuses to meeting the family and helping set up a house. I mean, we've really had to go and nurture the provider as a customer on the recruiting side to help solve what was not a problem several years ago and now is kind of, I think, for most healthcare industry, kind of the crux industry at this point is hiring.
Yeah. Thinking about it from a digital marketing perspective, do you all, and Ashley, I'll pose this to you. I mean, do you all like pull back? Do you have the flexibility to kind of pulse your spend, right? When you are recognizing those challenges, are you cutting off patient acquisition channels until you can get it right-sided?
Yes, definitely. All of our paid channels. I mean, we use an agency. We're a small marketing team. So finding a partner that knows that this week may be a crunch for you and 2 weeks from now, you may not need them is key for us. So making sure that your contracts align to kinds of those ebbs and flows that you may see in your markets was key for us.
Of this telehealth, being able to provide your services virtually, how does that impact? How is that being impacted by provider challenges? And I know you guys aren't there yet, but you're potentially approaching that point. And then how does telehealth ultimately improve the patient experience?
Yeah, we just had a discussion about that this morning. So much of in behavioral health is shifted towards telehealth. I mean, we're probably 10% in-person visits versus telehealth. Even now that, you know, COVID is behind us, this is the new reality in behavioral health. And so we've been lucky enough where we've hired providers outside of our states where they have licensing in our states, where we're able to guide a lot of those patients to a telehealth visit, obviously to somebody that's in Florida. But it has given us an opportunity with regards to the advantages of telehealth. It has given us an opportunity to recruit outside of the areas that we're in. I mean, we're in areas that are very difficult to find providers in Oregon and Colorado, especially behavioral health. So we've been lucky enough to be able to recruit outside of that, and we're able to compensate a little bit more heavily than in that local market because of the reimbursement levels. So telehealth has been really a gift for us with regards to in behavioral health, but I think that's going to be, I mean, this happened, you know, during COVID, and I think this is going to be a continuation, at least in behavioral health. This is not going to change. I don't know how that's going to affect the other two panelists, but it's been massively important for us. So,
yeah, I mean, I know, we had clients when COVID hit that pivoted as much as they possibly could. I know dental and dermatology to some degree, you need to be seen, but Amber and Ashley, I mean, is there any component to what you're doing or did do that, whether it's even just like an initial consult, new patient, inquiry that was being done virtually? Is there any part in your care cycle that
kind of changed the use case for using telehealth?
Mhm.
Yeah.
Yeah, we have similar experience. Obviously, in dental, you can't get work done if you're not in the chair. And in Texas, the Texas ruled teledentistry of any fashion not allowed yet. But what we do have, which I think has been helpful, is orthodontic side, especially with Invisalign and those other types of groups where you don't actually have to be at the provider for the crank of the old wire brackets and braces. And so they have started to integrate more digital. We have scanning that they can do. And then my daughter's in her braces. And so she sends her scans to the O, and then, that's allowed us to not have to go in as often. They just say, yes, now you're ready. Or, hey, crank your expander a little. So on the orthodontic side, it's been an advance but on the general patient side, we're not using any telehealth.
What about on the cash pay, on the aesthetic type procedures for consultation? Have you guys used telehealth at all with regards to that? No.
Mm-hmm.
Okay.
Yeah. Interesting point of view. Yeah, I know certain verticals, John, are even clients going 100% telehealth, and then there's a lot of areas where that's just not viable. So it's interesting how it does positively impact certain areas, but it would conversely negatively impact the experience on other sides. While we're kind of on this topic, I want to understand, we've been talking about what we're doing to drive positive experience. I want to see if y'all have any interesting perspectives on what you think the biggest friction points are. Like, is there a point in the digital journey, whether it's before they even know about your brand, all the way through to when they're being seen as a patient, where you think patient experience is most likely to break down? And Ashley,
is their information going to be accurate, or addresses, telephone, all of those things, services going to be up to date? So I think if we miss that boat there, in addition to like having the substance of the reputation piece with it, a lot of times the phone won't ring. And then the second piece that we've kind of touched on already, but is the patient self-scheduling. If it's not an automatic process and the patient is required to either chat or send a form request in, as soon as that communication breaks down with the front office staff and there isn't urgency to follow up with that patient, all the work that really went into getting that patient to decide, hey, I'm ready to schedule an appointment, whether it's paid or organic, kind of goes out the window. And especially if there's no availability, again, they're going to go down and go to that second provider that they found within their search standpoint.
Mm-hmm. Yeah, absolutely. Amber, any perspective on that from your end? And I know you've got individual brands, so it may be different for different groups.
I mean, I find because I'm over marketing and scheduling, I find I like Ashley's point of like, you got to find us first. I think for me, the biggest gap that I'm seeing is in that conversion to appointment, and it's the ability to contact the way that the customer wants to. So again, if I have to pick up the phone and then answer me, I think we lose a lot of potential patients through that funnel alone. Or if I'm on my phone and I found your website and I've gone to Google and I've done all the things and I'm in the middle of a meeting, right? Because I'm working from home and I've got a meeting going on. And now I have to call you to make an appointment, right? There's a friction point there that says, I want to meet you digitally and you're requiring that I call you. Mm-hmm. And so I think the biggest loss is not meeting the patients where they are when it comes to converting to scheduling that appointment. And either if they want to call us, but we're not answering the phone, right? Or they don't want to call us and we're forcing them to, and we don't have enough digital solution to bag all my groceries at this point, right? And so I don't want our patients to feel the weight of being the front desk person because we have 10 different pages of stuff they have to do. So it's really, for me, the biggest friction point is not meeting the customer where they want to connect with us in the way that they want to.
Well, and I think Amber makes a great point there. There is such a fine balance between balancing the patient, the ideal optimal patient experience, and operational efficiency.
Yeah.
And sometimes, I mean, at least in different organizations, marketing kind of sits within this, support office, corporate. They're making these decisions. They're finding these best technologies, then they go to implement it. But if there isn't operational buy-in, if there isn't physician buy-in, if they don't see the value, the revenue, the KPIs associated with those technologies, the buy-in to actually get them to create the operational workflows to then meet that patient where they're at don't exist. And then you have a technology that is not, implemented correctly of patients that are dissatisfied with the process and ultimately turnover in the front office because they don't like the process anymore.
Mm-hmm.
Yeah. And there was a question early on that I hadn't gotten to because I wanted to kind of wait, but I think it makes sense right now. Jessica had asked, how do you get the organization to rally around shared KPIs, right? So you guys have marketing KPIs. At the point of care, they have very different benchmarks for what they deem to be success. Obviously, both equally important because it starts online and ends in office. Do you guys have any thoughts on how you're managing KPIs all the way through? And John, I'll ask you that first.
Yeah, so I thought about that question when I saw it pop up or what have you. Just being able to share some of those success stories across the entire, with our providers, our support staff, and everyone that's involved, that is a reflection of those KPIs. I think is huge. I think it kind of gets everybody excited about what they're doing. I mean, it also goes back to the recruitment of who you're hiring for the support staff and from a provider standpoint. I think in behavioral health, it's very challenging for a provider, but we, myself and my business partner, our VP of operations, we're all very passionate about what we do. And that goes back to recruiting, even though, staff shortages is an issue. We are being very mindful of somebody being very passionate about patient care. And these success stories really resonate with everybody. And that really is a reflection of those KPIs. And I think that's a great way to rally around is sharing as many success stories as you can across the company. So
yeah. John, any tactical advice on practical ways to share that? Do you guys use company chat? I mean, just, some tips for anyone who's
I think there's actually a company chat that I'm not aware of.
You weren't invited to it?
But that's okay. There is a company chat that's going on, but, emails from, across, and we've shared it from state to state, right? From the providers in Oregon to the providers in Colorado. We continue to share as much as we can. But I think there is a chat. I forget what it is that they're utilizing. So
awesome.
Yeah.
And I mean, Amber, you've got the same thing, but at a scale of 90 offices in different states. I mean, how do you, as a marketing CMO,
it's easy at risk, especially individually in a department that says, look at how many appointments I set you, or look at how many people clicked on the website. Marketing is amazing. Or right, there's a ton of activity. Look at how many calls I answered today. And really, that is what creates friction, is by trying to celebrate activity and not results. Results meaning how many patients did we put in the seat?
Right.
And are we all talking about results metrics? Because I care about how many patients we put in the seat. The provider cares about how many patients we put in the seat. The practice manager, the operations team, we all care about that same result metric. And so when we are all communicating around results and we're talking about those metrics, and we can talk about communicate the activities that we're doing that we think are contributing to those results. But if all we do is come at each other with, well, let's here till 7:00 last night because you had me overscheduled and I made 150 phone calls today, right? That's a ton of activity that creates conflict and friction. And so I think the fastest way is just to make sure we're talking about the results. It's easy to get aligned when everybody knows that they want the same result for the providers.
Yeah, you can always back into it, right? Individuals, mm-hmm. You can always back into that, but the ultimate result is the key driver, right? So
yeah. Absolutely. I want to be conscious of our time and make sure I get a couple of questions from the chat while we're here. So I'm going to pivot a little bit. And this is something we haven't talked about yet, which is personalization in marketing. So we've talked about, unifying some tools to do it, how to know when it's good, when it's bad. But, the concept of the patient experience digitally being improved when you can make it feel like the experience was built for that person and not just for, everyone out there. I'll start with you, Ashley. Any tips or tricks or tactics that you're using at Vital Skin to personalize
that information in your electronic health records is one of our biggest initiatives over the next year. And being able to capture that data then allows us to build the campaigns and the automation around that personalization of their experience. So we're actually looking at a CRM and automation tool that will then allow us to connect those pieces together to educate the patient post-visit to whether, they need post-treatment follow-up, they need additional recommendations on products or on services, and continue that patient within the office as more of a reputational or relationship visit versus transactional. We didn't just see them for a rash today and hope that they don't come back again in 6 months or in a year, but gives us the ability to stay in front of them, to stay engaged with them and let them see that we're here from a holistic approach versus just the transactional, presentation that they actually came in with.
Yeah. And all three of your organizations, we have clients where, the objective, and I guess technically this is always the objective in healthcare, is to get them healthy and send them on their way and never see them again. All three of you are in kind of the preventative care. There should be at least annual, mental health is something we should all be investing in. So there's an element to, a patient benefiting from, re-engaging with the brand, even if it's not, in an urgent need. So yeah, I think it's really interesting to think about it in a post-conversion capacity, how you're improving that. That's probably, I don't want to say the easiest because implementing CRM is tough, but some information about them at that point. I think one of the questions we got in the chat was, what if you don't know their intent yet? Do you have any thoughts? And I'll pose this one maybe to Amber. When you're not quite sure of the intent yet, when you don't have
texting and call facing teams or bilingual, actually even in the practices they are as well. So I think that by making that digital experience match that's one of the first ways is that we connect based on the language which they prefer. Another thing that we do is we just ask a couple of key questions, even at the beginning of the journey, something simple as like, hey, have you been with us before? Are you looking for X, Y, and Z? And then as of yet, we have not implemented any chat bot responses because I worry about the personalization. I want to be able to text and communicate back and forth and it sound like I'm talking to you right now. I always talk to my teams about making sure that they feel like they just came to our home and that the practice to feel like we just welcomed them to our house and we're saying, hey, come on in. So that when we greet them on a text, that we say their name, see their family file, not just their individual file. We create family files. So we know, hey, it's time to bring Johnny in. Do you want me to go ahead and schedule you at the same time as him or X, Y, or Z? And so I really think that as of right now, we really still feel like that personal human touch is critical to creating that digital experience. So there's always people behind that. And then again, the other thing we can sometimes do is we watch where they click on the website. And we can understand intent that way. If somebody goes back to the services and they're looking at, braces, et cetera, then we can feed them information that way as well.
Yeah, I mean, I think personalization means so many things. We do something, or we try to do something as simple as, if I searched, if I came through on an implants keyword, that I am dropped on a page about that service and not just your homepage. I mean, that is personalization without having to know their name, phone number, email, their whole backstory. So I think that the concept of personalization is much broader than that. One kind of final question from the chat before I ask you guys closing thoughts.
So there's no problem with confidentiality or HIPAA.
Awesome. Yeah, I would say check your vendors, make sure that everyone you're using is HIPAA compliant. Usually, on the front end from a digital marketing perspective, just not implying known condition and kind of approaching it more from a brand perspective. What value do you bring to the individual? That's usually, how we approach it. So Helen, hopefully that helps you out there. We've got 6 minutes left. Let me kind of pose a question to each of you, and this could be anything that comes to mind. But I always like to ask, I'll start with John. What is your biggest focus closing out the year, looking at 2023 planning? What is your organization? What is going to be the biggest catalyst to growth for your organization?
Ensuring that, and it's not just because we're on this call, but having the right marketing strategy for the different service lines that we're going to offer, and how is that going to impact how quickly we can implement these and how successful we can be. That the two service lines that I'm referring to is going to be a significant financial driver in our ability to grow. And the question is how good is the marketing plan going to be into next year, that it can impact us in a quicker way with growing it internally, because two of our service lines can be done externally with regards to bringing those patients in. And the question is how good will that marketing plan be, where we will not have to grow slower on the internal patient activation versus the external.
People staring in their cameras instead of being in the offices all day. So cosmetic growth is a huge opportunity for our locations and in our markets, and really that personalization of it. It's lead management, it's lead gen, and tracking all those KPIs and being able to fill our practices, grow our providers, and all things cosmetics.
Quick thought on that statement as it relates to patient experience. Is that driven because the patients were looking for it? Is that like a response to what you felt the patients needed more of? Or is that, where do you think that driver comes from?
I think what you're saying, like demand in general, like where did it come from? Yeah, I think there's just a general sense of it being more acceptable within the industry. Services are advertised more than I feel like they ever have been, and just the overall need and desire, and especially in rural communities. These used to be services that were available only in bigger cities. Now our practices are in rural communities, and we have patients not wanting to travel 2 hours. They're working from home. They want to have it done locally, and there's really an opportunity to expand and grow those service lines there.
Awesome. Amber, I'll let you close us out with your thoughts on where your head's at for next year.
Yeah, so our biggest focus right now is what can we centralize when we automate, and what can we offshore, so that we can protect our resources to make sure that our practice staff and our practice employees get paid as well as we can for the services that we absolutely people on the ground to provide. And so we're just doing a lot of work around like, where can we, again, we talked about scheduling. So where can we centralize any services, insurance verification, what is it that we can pull off the practice and centralize and get more efficiencies? What can technology do? And then again, what can we do overseas and make the best offer?
We'll be sending out this recording. You can always respond. It'll have my contact information, and I can connect you to any of the panelists if you needed further information from their perspective. So thank you guys so much. I hope to have you on again soon.
Yeah, thanks for having us. Thanks, everybody. Bye-bye.